Hi, my name is Susie, and today I'd like to present the findings from a recent piece of research that I and some colleagues from UCL have done on the social and clinical factors associated with the involuntary psychiatric hospitalisation of children and adolescents. And this research was published in the Lancet Child and Adolescent in April of this year. I'll give the reference to the study at the end of this presentation, and if you want or can bear to hear more, please do listen to my colleague and co-author Ramya and I talking to the editor of the Lancet Child and Adolescent about the research in a podcast. So before talking about current concerns about mental health law, I thought it would be helpful to try and put things into a little bit of historical context. In the UK, the detention of mental health problems was first regulated in law in the 18th century. The Vagrancy Acts allowed the apprehension of the furiously mad and dangerous so that they could be safely locked up in some secure place. The emphasis here clearly on the containment of the mentally ill for the protection of society rather than protecting those with mental illness. And these places of containment could be asylums, but also workhouses and jails. And one of the most famous asylums was the Bethlem, which is depicted here in this etching by William Hogarth, which was done in 1735. Over the years, the focus of mental health law has changed from containment to support, and each new Mental Health Act has introduced more rights for those detained, including shorter admissions, more chances to appeal, and entitlement to aftercare services. So the Mental Health Act has come a long way from where it started in terms of safeguarding patients, but there have been growing concerns about the number of people being detained and disparities, particularly racial disparities, in the way the Act is used. But almost all of the research to date about involuntary care is based on adults. Initially, I and others thought this might be because there weren't many children and adolescents being detained or that the numbers were dropping, but this was mainly because there was no access to data until January 2016 when this was published for the first time. And as you can see, in fact, the number of children and adolescents being detained under the Mental Health Act in England has actually been steadily growing since the data was first collected. So in adults, we know that there are a number of factors that seem to be associated with involuntary hospitalisation, including being male, being from a black ethnic group, having a diagnosis of psychosis, or having been detained before. And we wanted to know whether there were any factors which might be associated with involuntary care among children and adolescents, and thought this was important as it may suggest that interventions to prevent or reduce the use of involuntary hospitalisation might need to be put in place much earlier than has previously thought. So we conducted a systematic review, meta-analysis and narrative synthesis to look at this. We used 4 databases and included papers which compared voluntary with involuntary patients with a mean age of 18 or under. We didn't limit the search by date or language. Our search initially found over 3,000 studies, but unfortunately only 23 met criteria, and most of these were of moderate quality. On meta-analysis, the factors that we found to be significantly associated with detention were a primary diagnosis of psychosis, intellectual disability or substance misuse, being from a black ethnic group, and unfortunately due to the limited data we had, it was necessary to collapse ethnic groups into these rather unhelpful categories, but also older age and risk to self and others. There were few clear conclusions from the narrative synthesis other than more severe clinical symptoms and lower levels of global functioning were associated with involuntary admissions. So there's lots I could talk about from this study, but perhaps the key point is that based on what we must remember is a very limited number of studies, the main risk factors for detention among children and adolescents are having a diagnosis of psychosis or intellectual disability and being from a black ethnic group. It's hard to understand why ethnic inequalities in involuntary hospitalisation among children and adolescents has received so little academic, clinical and political attention so far, and this needs to be urgently addressed as it may be contributing or establishing a cycle of inequality that continues into adulthood. Also, the fact that having a learning disability was so strongly associated with involuntary psychiatric hospitalisation is also very concerning. A joint House of Commons, House of Lords report noted that when young people with a learning disability are detained, it's usually the result of a long and predictable series of failures to appropriately support them and their family. This study raises a lot of questions, such as what can we now do to reduce involuntary admissions and ensure equitable access to mental health services? What factors influence clinical decision making, and what do young people think about the experiences of being detained? And some of these I hope to answer with my further research. There were multiple limitations to the study, the main one being high heterogeneity between the studies, likely because of the fact we use studies from a range of countries with different legal criteria, mental health systems and processes, as well as a range of study methods. But this is, to our knowledge, the first international systematic review of social and clinical factors associated with involuntary psychiatric hospitalisation of children and adolescents. And we hope that a greater understanding of the factors that lead to involuntary hospitalisation of people under 18 will help improve access to mental health care for all people of all ages. Here are my references and my email address, and please do contact me if you have any thoughts or questions about this work. Thank you for listening.